Hello and welcome to Wellness Wednesday. I'm James Currie with the Communication Department here at MCHD, and I'm talking to Anthony Cutchens. He is a registered nurse here with Family Health and MCHD. How are you?
I'm doing well, James. How are you doing?
Fine, thank you. Never better. Today we're talking about hepatitis A, also referred to as HEP-A. So if we say HEP-A by mistake, we're talking about the same thing. Um,
Absolutely.
so give us a little bit of background. What is hepatitis A?
So, hepatitis A is actually a virus that causes inflammation of the liver
Okay. Um, so why are we talking about it right now?
Currently, here in the state of Alabama, and especially down here in Mobile County, Alabama, we are experiencing a hepatitis A outbreak. Hepatitis A
Okay.
is extremely communicable in humans. We are an ideal vector because we use our hands a lot. We're constantly touching surfaces and picking things up and putting them down, and that makes us a really good target for hepatitis A virus.
Now we're talking about Hep A, but there's also Hep B and Hep C. So what are there subtle differences between the three of them?
There are the biggest differences for the public to remember are the transmission modes typically seen for each of the three hepatitis. Hepatitis A, we typically contract through what we call the fecal oral route. Now, that means that we have been in contact with feces, with poop, and we have
Yeah.
either eaten or
Yeah.
touched our mouth or our face, and we have ingested the virus that way. Hepatitis B, we typically see as a sexually transmitted virus. And then hepatitis C is typically seen with IV drug use or shared needles, dirty needles. Those are typically where we see those three hepatitis coming from.
So it's definitely a vaccine preventable infection, right?
Absolutely. We have hepatitis A vaccine here at all Mobile County Health Department locations. Um, and we encourage everyone to attempt to stay current on their immunizations. Um, we actually have an appointment line here at Mobile County Health Department that is 251 690 8889. And you can call that line at any time during business hours and reach somebody who will set you up an appointment so that you may come in and get your hepatitis A vaccine.
That's right. We do that here and all of our locations throughout the Mobile County. Um, Now, how serious is Hep A?
Hepatitis A is what we call a self limiting virus, in that it typically, whenever humans will contract hepatitis A, we will contract it and it will run its course and it will self limit and we will eventually eliminate the virus. However, hepatitis A is a serious condition when it comes to our older populations. Any population that is at risk or has other hepatitis, if you already have hepatitis B or hepatitis C, um, or you have cirrhosis of the liver, any sort of comorbidity is going to increase your risk of having trouble fighting off or getting through that period of illness with hepatitis A.
Wow, as if 2020 wasn't bad enough. So yes, now we have to deal with an outbreak. So is it pretty common?
Uh, it is becoming more common as, like as we said, the outbreak is moving through the state of Alabama and has kind of concentrated in Mobile County. It is becoming more common, certainly. Um, However, the best way that we can prevent hepatitis A is through diligent hand washing with antibacterial soap. Excuse me. Um, Anytime that we are getting ready to handle food or eat or prepare food for ourselves or others, we want to make sure that we're diligently washing our hands with antibacterial soap. We also want to make sure that we are being super diligent about hand hygiene in the bathroom. We are using antibacterial soap after we go to the bathroom. using our paper towel to turn off the faucet and grab the door handles, just doing all the things that we can to prevent ourselves from picking up a virus on those high-touch surfaces. And then there are also some other arenas that we don't often think about, and that's touching surfaces in public areas, um, changing diapers, aiding in cleanup if you care for help with a geriatric family member. All of these situations can put us at risk to come in contact with fecal matter, and we just need to make sure that we're being diligent about our hand hygiene. That's the biggest advocate for fighting off hepatitis A and the vaccine itself.
Which is also good because we should already be doing that now for the coronavirus, right? Uh,
Absolutely.
so hopefully that will help some of the outbreak. I have some notes here that I wanted to ask you some questions. You may have covered some of this, but um, who typically is at risk for Hep A?
Typically, with hepatitis A, we are seeing populations um, in transient housing situations, people that are homeless or maybe are moving between point A and point B, those individuals that maybe lack the ability to obtain some proper hygiene. We're also seeing an increase in hepatitis A in individuals who are having oral or anal sexual contact, as well as anyone who is possibly using IV drug use. Those are our increased risk factors. We're sitting right at around the 60% mark for our demographic here in Mobile County.
Hmm.
About 60% of our cases are IV drug users,
Hmm.
and those who live in close proximity to other individuals and our lower socioeconomic climates. And so it's just really imperative that you prioritize hygiene and seek the vaccine. Give yourself a leg up with the vaccine.
Excuse me. Now you talked about the vaccine. So if someone's vaccinated for Hep A, likelihood of them getting it's not very high. But if someone does get it, they're not vaccinated. Can they get it again?
So typically, we see once somebody has either been vaccinated with the vaccine or they have contracted and the virus has run its course, your body will create an antibody response to either the vaccine or the illness itself. You will create antibodies, and then your body will be able to fight off hepatitis A in the future whenever it encounters it.
Hmm.
Um, and so, whether you go about it through the vaccine or through contracting the virus and fighting it off, you're going to obtain some antibodies either way. It's just the vaccine's a little bit easier on you.
I see. Um, Now, what are what are some of the symptoms that people need to, if you have these symptoms, go to the doctor for these symptoms?
Absolutely. So, some of the biggest symptoms that we see in our hepatitis A confirmed cases are our fatigue, um, our nausea, vomiting, diarrhea, abdominal pain. Often patients will notice that their skin or the whites of their eyes will become yellow or start to yellow a little bit. This is sometimes referred to as jaundice, and that's one of our symptoms that we look for in hepatitis A. Um, Another key symptom that we look for or ask about typically whenever a patient presents to the emergency department is the color of your stool. Um, we sometimes see pale, light clay colored stools with hepatitis A, and we also typically see dark urine in hepatitis A.
All right, so if you have any of these symptoms, you go to the doctor, you're going to get a diagnosis. So, how is it diagnosed and how do you treat it?
Yes, so whenever you've gone to your primary care provider or urgent care of the emergency department, wherever you are, they are going to run a simple blood test in order to determine if you are reactive for hepatitis A. And then once we have determined if you are positive or not, if you are positive, hepatitis A unfortunately does not have a a specific medication or a drug that can cure it and be done with it immediately.
Mhm.
What we call hepatitis A, we call it supportive therapy. Your body has to essentially ride it out and get through that period of symptom onset. And once you come out the other side of it, you will have those antibodies. But there is no actual cure for hepatitis A, just supportive therapy.
I see. Excuse me. All right. So people thinking about getting the vaccine, they're worried about the efficacy. So how effective is the vaccine?
It is very effective. We see a lot of our at-risk populations that we offer the vaccines to do not become a statistic because whenever the opportunity came along for them to get their um, free or low-cost hepatitis A vaccine, they were able to obtain it and prevent themselves from becoming one of the statistics here in Mobile County.
Um, I know, we do vaccines. We had spoken about that just a few moments ago. We do vaccines here and all of our other locations. Um, I know from working here, if you go to another part of the country, that there are certain vaccines that are required for those particular countries. So, are there any travel restrictions about Hep A?
Yes, absolutely. Great question, James. What I would refer everyone that's inquiring about travel internationally, or maybe even to another state here within the continent, you can go to the CDC's website and research travel. And you can also reach out to the Mobile County Health Department if you are having trouble locating those resources. But that's going to be your best resources to go to the CDC and look at the travel requirements for the specific country or region that you're looking to go to. And that way you will understand fully what viruses are most at risk in that country that you're seeking to travel to and what immunizations are recommended before you travel to that country.
So it's just as easy as going to Google and typing in CDC travel vaccines. Should be a link for that particular page. You select your country, and if you need those vaccines, you can get in touch with us here. It's 251-690-8889 to make that appointment for the vaccine. Um, so just to wrap up, Hep A is a very contagious disease, but it is a preventable liver infection. And one thing we didn't cover though, how long do the symptoms kind of last for Hep A?
So that's a great question, and that's something that I speak with a lot to our HEP-A cases here in Mobile County. Our symptom onset and our symptoms lasting, typically it's a 2 to 4 week period where from the onset, from diagnosis of hepatitis A until the individual feels completely 100% back to normal, we're looking anywhere from 2 to 4 weeks. However, I think I mentioned this earlier in the video, depending on what comorbidities that individual may have, if you have, cirrhosis of the liver or any other hepatitidity, hepatitis B or hepatitis C, you may have a harder time fighting off hepatitis A. It may take you a little while to return to your baseline. So it's highly individualistic, hepatitis A, and how long it takes for us to get past it. Typically in our pediatric population, we have pediatric populations that whenever they have hepatitis A, they might not have any symptoms at all. And it's just one of those things that they're young and they're strong. And
Mhm.
as we become older, as we have more comorbidities, it will increase the time that it might take us to return to our baseline.
Now,
But typically, we're
comorbidity,
looking at a 2 to 4 week period.
yeah. You said the word comorbidity quite a bit. We've been talking about that a little bit off and on. So, can you
Yes.
put a quick
Let me
definition?
elaborate on that.
Yeah.
Yes. So when I say comorbidity, I'm referring to other diseases or disease processes that you currently have going on in your body. So if I was to say, what comorbidities do you have, and you told me that you currently have COPD emphysema, and type 2 diabetes, and cirrhosis of the liver. Those are 4 comorbidities. So what we're saying is you are having hepatitis A and you have 4 comorbidities along with that. Those are pre-existing or existing conditions that you're currently also battling or managing.
Thanks for clarifying that. I know that sometimes that is a question that we get. What is that? Sometimes we don't hear it that often. We've heard it a little bit because of coronavirus, but thank you for clarifying that. So,
Absolutely.
so just to wrap up, the reason why we're speaking is there is a hepatitis A outbreak in Mobile County, southern part of Alabama, and it's preventable. And, you know, it could be something as simple as going to get the vaccine.
Absolutely, James. That's something that we're battling right now with public health here in Mobile County. We are doing our best to be reactive in that we are reaching out to patients once they've already had a hepatitis A diagnosis and asking them about their travel, if they knew anyone else that was having similar symptoms. But our hope with these videos is that we can be more proactive and that we can get ahead of the hepatitis A outbreak and that we can encourage those individuals that maybe do not have the vaccine to go into one of your local health departments or even your primary care provider if you prefer. In order to get that hepatitis A vaccine and just give yourself a leg up in the community. I find myself all too often speaking to patients and having to assure them and reassure them that it's not necessarily something that you did wrong. Unfortunately, hepatitis A is picked up and can be picked up on any surface. I mentioned earlier in the video that humans, we touch, we eat with our hands. We are constantly touching things in our environment. And that's why we are such a good vector for hepatitis A, because we can pick it up and we can transmit it all around our environment. And that's how the virus thrives. So our biggest way to combat that is to be proactive and encourage the community to please reach out to your health department or your primary care provider about getting your hepatitis A vaccine to prevent you from contracting it in the first place, as well as to practice diligent hand washing whenever you are going to the restroom, whenever you're in public places, as well as whenever you're getting ready to prepare food for yourself or others or consume food.
Great information. Thank you for going back over those tips again. So also too, Anthony, thank you for being on Wellness Wednesday and speaking about hepatitis A. And
Absolutely.
thank you again for watching Wellness Wednesday, and keep following us on Wednesdays this month for different health topics. Thanks again.
Thank you.